And these are used for people who still have a tracheotomy with a trach in it, and they're off the ventilator, but they haven't had the trach pulled yet because they're going to make sure that they're okay and stable before they pull the trach, okay? So these are set up to a suction setup, airway setup, to keep oxygen flowing along with humidified air, so it will keep the trach nice and moist inside. So a lot of times on the floor, that's where these patients will go. Now in a ventilator, they're definitely in the unit. I've only seen ventilators on the floor when they've been, like I had a gunshot wound to the head. The family thought the hubby did it on purpose. And she remained alive for over 6 months on a ventilator. So they can't keep them in the unit for that long. And they're stable, so they send them out here. As a matter of fact, that was my first LPN ventilator patient student. Okay, we all got to practice on that little lady. Okay, so what we're going to deal with first is we're going to prepare to suction them out before we do all the cleaning, because what we want is to make sure the airway is patent before we start messing around with cleaning and manipulating that trach. Okay, you can do this by yourself, or you can get a partner to help you. This is a sterile technique. And usually there's a setup in the room with a bunch of these already in there, so you don't have to run around. If there isn't, go ahead and get some for the day. There we go. Now you will not do this the first time by yourself, by any means, on a real patient. You will get your preceptor to help you out with it, okay? Not all kits are set up the same. This kit has the container right inside the glove. Some of them have them to the outside. Archibald's is to the outside. These kits are sterile inside, just like any other glove container. This is sterile on the inside. You can go to the bottom of it and open it up. You cannot touch the inside. That is sterile. But what you can do, if you're by yourself, you can just go ahead and pour your saline in, open, lip, and let the water push it down, okay? Or you can put on your sterile gloves and take your 2 fingers and push it in, because you're sterile to sterile at that point. Your parameter is still 1 inch around, just like for your gloves. Okay. Now these are the worst gloves and setup that the company can put together.
That's what I'm saying. I want to see
because they're all crunched together, and you're lucky if you can see an edge to get your hand on the edge of it. But just like applying sterile gloves, you will do the same. Now look. Okay. Okay, let's try it this way. I should have taken my rings off. I suggest you do take your rings off. There, came loose. Staying on the cuff. Same thing with any sterile gloves. Stay on the cuff. See, now I've messed up already. Okay. No, I didn't. I won't let it go like that. I can pretend. Okay, sterile gloves. You'll see what I'm talking about in a minute. Okay. Now, what we need to do is set up our suction and everything. What we're going to wind up with is one hand being unsterile for the entire time. Okay. But while we're setting everything up, like if I wanted to go ahead and pour my water in later and fix my bag, because sometimes these bags are just stuck to the outside, period. There is no putting saline into that. It's going to go all over the place. So you have to wait to put your gloves on, push your thing in, make sure you stay in the center, don't contaminate or touch anything else. Okay? But remember too, this is the point that you do that first, then you can pick up your saline and pour it in. Or, hey partner, how about pouring me some saline in there? This is still sterile. Still in the bag. The only thing exposed is the tip. And I can work it down with my fingers. Okay? My suction setup, now I'm no longer sterile. I want to put this on, and anywhere between 80 and 120 is okay for suctioning. That's your suction. Okay? Now, as I'm removing this, I want to be very careful because the last thing I want is for this tubing to touch anything. Partner your tubing. Okay, you need to remove the collar. Now, if they're intubated, usually all you have to do is remove the collar. But if they're ventilated and you have to remove the ventilator to suction, then you're going to need assist to get the ambu done. Or you're going to have to get real Dexy about having to do it yourself independently. See, like moving this darn side rail. You can't do it with both hands. You can only keep the one dirty hand. Everything's got to stay sterile. But I have done it where I've had to ambu my patient myself with the dirty, come back, and get ready for the next round of suctioning. Okay? Now when this thing comes out, don't touch anything but the glove. Check it for patency. Make sure you've got a good suction. Okay? If I'm by myself, now I can use this hand to manipulate or do whatever I have to. But I got a partner. So I'm going to say, ventilate my patient for me. I want 3 to 5 ventilations. So go ahead and apply the mask to the face. The nose part is up. Yeah. Nice slow. Okay. At this point, I'm getting ready to suction. This thumb does not stay on it at all to enter. It's always clear of the port. You go down. Don't let this thing touch you anywhere. You go down and you hit the bifurcation. That's as far as I can go. Back up 1 centimeter or 2. Now I'm ready to start suctioning. Suction, suction. Please ventilate my patient. Clear my line. Okay? Keeping this at all times sterile. I don't like where my suction cleaner is. It's too far from me. Now, she's ventilated, and I'm going to do it again. Same thing. The trick is never longer than 5 to 10 seconds. Never touch anything but the inside of the cannula. When you pass it in, hit the bifurcation, back it up an inch or a centimeter or 2, that's all, and then proceed to suction. Wrap, ventilate.
Okay. How you're coming out, like you're doing a swirl.
You do a swirl.
Swirl, okay.
You do a swirl. The reason you're doing a swirl, look how small the cannula is, look how wide the opening. Secretions are all inside, all around it. Okay? Hit the bifurcation, back up 1 to 2 centimeters, thumb aboard. That's 5 seconds.
So you don't hold your thumb on the thing you...
Intermittent.
When you put your thumb on it, it starts up.
Because where are you? You're in the lung. You keep your thumb on it the whole time, you're sucking air out.
Yeah.
Out of the lung. Don't want to collapse the lung, just want to get secretions out.
So what are you doing with your thumb now?
Like patting it.
Off and on.
Once you pull it back the centimeter, right?
Okay, watch again.
Okay.
Ventilate. That's good.
You going down, she's holding it over.
No, actually, I'm not touching it.
Okay.
But my thumb is ready.
Okay.
Okay, bifurcation, back up 1 centimeter or 2.
Okay.
Ventilate. Now, if I'm by myself, I couldn't ventilate. I don't want to. I wanted to do it that way. Clean the line. Clean the line. You can keep your thumb down on it when you're cleaning the line. But remember, if you're going to do more than 2 or 3 passes, you're going to run out of that pretty quick. So now you got to go.
Yeah. Okay, so if you're by yourself, you'd hold that with your sterile hand, then with your dirty hand, you grab this and do that. Okay.
And I have. If this darn side rail was down, I could do it right then. This is not exactly the device that you're going to use either. What you're going to use is one that's attached to the trach itself. But if they're stable and in their room, this will work too, providing that the balloon is down. So yeah, I could easily, not easily, I shouldn't say easily. You can
It's
do it
possible.
proficiently. It's possible, but it's always nice to have somebody else come in there and help you out. Now, the beauty of Archibald is that if they're on a ventilator, they have the Ballard system. Remember I said that's a piece of plastic that's attached to the actual trach. And all you have to do at that point is take that cannula, because it's in a sterile container. You never remove it from that until it's time to change it out. And every 72 hours or so, they change out that Ballard. But it's because it's in this sterile container, you don't have to worry about all that. You don't need sterile gloves. All you do is pass it down, feel it hit the bifurcation, back up, and then start suctioning the exact same way you do with these. Okay? The difference is that it stays in that sterile environment. Okay? So that's what you're going to see. That's what you're going to get to experience. Okay? And IMCU does have vents as well. Okay? They get them from ICU. They don't get fresh vents in IMCU. They get fresh vents only in the unit, meaning they just got the vent, they're going to go straight to ICU. Okay? When they're stable, IMCU collects them. Okay? Any questions about this?
And you said you do that for 5 to 10 seconds only.
Only.
And only 3
And no
times.
more than 3 times.
No more
Then you
than
let them
10
rest.
seconds. Okay.
If they're on a ventilator, you put the tube back over, the ventilation tube back over, and you let them rest for a while.
Okay.
And your assessment will tell you when you're ready to suction again, but it won't be within that first 5 minutes.
Right.
Okay? Questions?